Hello and welcome to today's video. In this video today, we are talking about long COVID clinic. More specifically, we're talking about what it is and what happens in a long COVID clinic. So let's get right into the video. A lot of us have been going through the story, whether it's personally or somebody we know, whether you say got COVID in 2020, you waited to get better and it never really got better. So you stayed breathless, you stayed fatigued, then new symptoms started joining the old ones. You started to feel joint pains and muscle aches, cognitive impairments, which can affect concentration and memory, cough, dizziness, gastrointestinal symptoms, and so on. Now, these symptoms are wide ranging and often fluctuating, but according to NICE, or the guidelines in the UK at least, NICE defines symptoms after 4 weeks as ongoing symptomatic COVID 19 and after 12 weeks as post COVID 19 syndrome. So, long COVID, in other words, can be said that after 12 weeks it might be going on. There's a long list of symptoms. UK studies find more than 200 across 10 different organ systems, but the most common ones are the ones we listed here. So that's what we categorize as long COVID according to the guidelines. So let's say you are experiencing these symptoms and you can only do something for 15 minutes and then you have to stop and recover. Meanwhile, your friend is back to normal or the symptoms are extending and your doctor just doesn't seem to believe you. So it's more common than you think. Out of all the people in the UK that have gotten COVID 19, about 1 in 5 of those affected has said their ability to undertake daily activities has been limited by a lot, by symptoms continuing for more than 4 weeks. And to give you even more context, about just under 2 million people in the UK, almost 3% of the population, were estimated to have long COVID. And this was checked this past March, so not too long ago. So where are all these people with long COVID going? So by July 2022, there were about 90 post-COVID services that had seen around 60,000 patients and received a whole load of funding between the 3 years, between 2020 and 2023. So a lot has been going on and there's been a lot of focus on this long COVID story. So let's map this story out. What actually happens? So we're going back to the story of the person who is having long COVID symptoms, especially extending beyond 12 weeks. So you're the patient and you go to see your GP, you go to see your doctor, your family medicine physician, and then after identifying a long COVID picture, after excluding other reasons and other causes, you get referred to the long COVID clinic or long COVID service. Now, usually these services were an extension of respiratory or cardiac services because that's where the main symptoms are, but it's more frequently found that a pain type of service or an extension of a pain service is more critical to this. And the reason for that is because there's a recognition that many patients with the condition suffer with pain and fatigue, and there can also be similarities in conditions already managed as such as chronic fatigue syndrome and fibromyalgia. Now, 80% of these patients have never been to the hospital. They've never been to intensive care. Women outnumber men in terms of getting referred to the services, and the common ages are aged 25 to 64. So what then happens at this COVID clinic? So the team triages new patients based on a detailed questionnaire, and then they get offered an assessment with the staff thought to be most appropriate. And often this is a combination of a doctor and a physio. This then leads to a 45-minute face-to-face appointment talking about the symptoms and discussing the next steps naturally. As you can see, this is quite detailed, and this is just one of the types of long COVID clinic services that are available. So what then happens during this 45-minute appointment? So further physical assessments can be requested. You have to look deeper whether there's any other causes that are going on. You can get more blood tests done, more referrals done to cardiology or respiratory specialists, for example. And overall, it needs to be navigated in a way through which a long-term condition is navigated. We can prescribe pharmacological treatments. So there's no pharmacological treatments recommended specifically for long COVID, but you can prescribe medication to tackle symptoms. So pain medication, antihistamine, inhalers, ivabradine, which is a drug that can manage the heart rate in patients with POTS or postural tachycardia syndrome. So these are all the things that can occur. And then after that, we get placed on a rehabilitation pathway. So this is generally community-based, and it usually involves 6 sessions with a physiotherapist as well. There can also be involvement of holistic therapies such as flotation therapies, which has been provided. The clinics are very much focused on pacing and understanding that this is quite complex. And as you can see, there are a lot of team members in this whole thing. So there's medical leadership, there's psychology, physiotherapy, diagnostics, general practitioners or doctors involved, occupational therapists, and overall, this then needs to be put together into a complex multidisciplinary team to manage this situation. But the critical thing here is that it's not a magical thing. So there's no magic pill that will help solve this. We need to take it slow. We are advised to pace ourselves here in this clinic, to slow down and pull back. A lot of the times when we're ill, we want to just power through it and push through it and go back to work and get back on the horse. But that's not the case sometimes, and we need to just take a breath, evaluate the situation, and go from there. Now, what I just described here in this video was one of the models of a long COVID service that is available. So the UK as a whole, and probably other nations and so on, has taken a different approach to supporting people through long COVID, but the general consensus is that it's a positive thing and there's a huge positive feedback regarding it. So in Wales, for example, they have the recovery program, which offers a tailored multidisciplinary care approach. So GPs can refer to this, just like I mentioned in this video, but there are no strict long COVID clinics. The Scottish system implements something quite similar as well, in addition to the Northern Irish system as well. So Northern Ireland, patients can access multidisciplinary assessments and then go from there, looking into other aspects of care. So overwhelming majority has a positive feedback to this, a positive experience to it, and it's really important to understand that you are not alone if you're experiencing these symptoms. And also there are other modalities which can help, so such as Living with COVID recovery app, you can have website services as well available, and so on. I'm going to leave links in the video description below regarding this. And please don't feel alone if you're experiencing these symptoms. There's more and more expertise being launched into it and funding being available for it. And if you're experiencing these kinds of symptoms, then you should speak to your doctor and not be ignored for them. So that's it for this video. I hope you learned something, a little bit of a dive into the long COVID clinic story and the long COVID clinic services that are available. Let me know what you think in the comments below. I look forward to reading them, and we'll see you in the next video. Take care.